There's two ways to go about checking tube placement, one with an x-ray and two with a pH strip. The x-ray is our gold standard, so if given the option, we're always going to pick the x-ray. The pH strip is for after we have initial verification with the x-ray. We are never going to connect the tube to suction or push anything into the tube without having that initial x-ray confirmation. If we're checking the pH with a pH strip, we're going to aspirate some stomach contents, put it into a medicine cup, and check it with a pH strip. This only works if our patient is fasting. So the reason being is that their formulas will change the acidity of the stomach and we won't get an accurate reading. So if our patient is fasting, we're looking for a pH of 5 or less in the stomach. And if they're fasting, we're looking for a pH of 6 or more if the tube is in their small intestine. So when we go about checking the placement with the pH strip, we're going to take a syringe and push in 20 milliliters of air into the clear tube. This is going to clear the line out so we know that we're getting stomach content and not anything else. So we're going to pull back 5 to 10 milliliters of gastric content, put that in the medicine cup, dip the pH strip, compare. Hopefully we get the number that we're looking for. And then we're going to flush the tube out with 30 milliliters of water. So it's very important to flush the tube afterwards so you don't have stomach content clogging up the tube. So when are you going to check the placement of the tube? You're going to do this routinely every 4 to 6 hours or whatever your hospital policy tells you to do. And before you administer anything, so whether it's feeding, it's a pill, it's a water bolus, you're always going to check the placement before you put anything into the tube. We want to make sure whatever we're putting in is going into the right spot. So for the question, why should you wait at least 1 hour after medication administration to check tube placement? That's because, remember, we're aspirating stomach contents when we check the placement. So if we crushed up these pills and put them in the stomach and then go ahead and check placement right after, we're pulling back all of the medicines that we just gave that the patient needs. And here's some troubleshooting. So what happens if you go to aspirate and you can't get any gastric content back? Maybe the tube is blocked or partially blocked and it's really sluggish and you're having trouble pulling back enough to measure. If you have an x-ray confirmation and the following 3 things are met, there's no risk factors for tube dislocation, the tube is in its original spot, and the patient isn't in respiratory distress, then and only then can you go ahead, assume the tube is in the proper place, and go forth with whatever you are going to do.